Is a skin biopsy required to diagnose psoriasis? Many people wonder if a skin biopsy is necessary to confirm psoriasis. The good news is that most cases can be diagnosed without one. Usually, a dermatologist can identify psoriasis just by examining the skin. They look for characteristic signs like well-defined, thickened, red patches covered with silvery scales. The typical locations include the elbows, knees, scalp, and lower back. The pattern and appearance of these lesions often make the diagnosis straightforward. Doctors also consider your medical history and family background. If you have a history of psoriasis or related conditions, that can support the diagnosis. In most cases, this clinical approach is enough to identify psoriasis accurately. It is a quick, non-invasive process that avoids unnecessary procedures. However, sometimes a skin biopsy might be needed. This usually happens if the diagnosis is uncertain or if the skin looks unusual. Conditions like eczema, skin infections, or even skin cancer can sometimes mimic psoriasis. In these cases, a small sample of skin is taken using a punch tool. This involves removing a tiny cylindrical piece of skin, usually about 4 millimeters in diameter. The sample is then examined under a microscope. Microscopic features of psoriasis include specific changes like Monroe's microabscesses, which are clusters of immune cells in the outer skin layer, and thickening of the epidermis. These details help confirm the diagnosis and rule out other skin conditions. The biopsy results typically take about a week to come back. In summary, most psoriasis diagnoses are based on visual examination and medical history. A skin biopsy is only performed when the diagnosis is unclear or when doctors need to exclude other conditions. This approach aligns with current medical guidelines, which prioritize non-invasive diagnosis first. If you suspect psoriasis or have skin concerns, it's best to see a healthcare professional. They can evaluate your skin properly and recommend the most appropriate course of action. Remember, each person's situation is unique, so personalized medical advice is always the best choice.